Now, the free market has worked where it's tried. And the question is, will the free market work in medicine? And the answer is it already is. If you look in parts of medicine that have broken out of that system, they do astonishingly well. LASIK eye surgery is a great example. It's been around for a number of years, and the insurance company is not involved, and the government is not involved in that way. And so now you have patients who can be informed consumers, and they can shop for quality and they can shop for price. And I'll tell you something, I've been everywhere in this country, left and right, top and bottom, and I'll say if there's one thing about Americans, we're pretty good shoppers. It's funny, but it's not. It's true. We are actually very informed and wise consumers, and we know how to make decisions that are optimal for us and for our families. We do that with things that are a matter of life and death every day. The car you drive, where you live, the food you eat, these are all matters of life and death, and they all have to be balanced against that equation. We do it without even thinking about it. But because we're so effective at it, we can do that with healthcare too. And look what happened with LASIK surgery. The availability has gone up, the success rate has gone up, the effectiveness has gone up, the expense, the costs have gone down, patients are happy, doctors are happy, and all of this has been a success story, and it shouldn't surprise us, because the same thing works with HD TVs, it works with breakfast cereals, it works with everything that we allow to go through the free market and work. And if we would allow this to go with medicine, we would see the giant sucking sound would be the wasted money that we spend in the healthcare system not needing to be spent. And I'll tell you something, I may be a beneficiary of some of the wasted healthcare dollars as a medical imager. We talk about overutilization or defensive medicine. What do you think that means? It means a lot of things they could be doing, but one of the common ones is imaging. If they're not sure, image the patient. Still not sure, image them again. Get another CT, get an MR, and follow up in 3 months. And any one of those studies, you can certainly say is a reasonable thing to do. It's hard to put your finger on any one case that is, but we know that much of it must be. So I say this saying, if we could eliminate some of those, I'm not sure what direction that would affect me individually or as a physician, if my income would be improved or if it would actually go down because some of that would happen. I couldn't tell you, I don't know. There are different schools of thought on that. If it went down for that reason, I would be happy with that because I know it's the right thing to do. I know that every dollar we spend somewhere other than treating a kid with diabetes or your mother who has rheumatoid or anything else that really needs to be done is being wasted. And we spend that all the time. Finally, I'd like to say, in this proposal, and one of the reasons that this proposal really needs to be looked at, there's been a lot of noise about all of healthcare. We have made a lot of boogeymen. First we tried to make the doctors out as though they were the bad guys. That didn't work so well. Then we tried to make the insurance. They tried to make the insurance look bad, and they seem to be sticking with that. And there's reason that we can be frustrated with our insurance companies, but the reason for that frustration, like we said earlier, is not necessarily the insurance company's fault, as opposed to the government's fault. But one of the things they want to do is they want to turn your family doctor into your family rationer. They want to set a rule, the 10% rule. Now 10% is a nice round number, it's arbitrary. Some smart people sat in a room and said, how do we get these costs down? Well, one way is we provide less care. How do we do that? We go to all the primary care physicians and say, if you refer your patients on to a specialist and you are above the 90th percentile of physicians who do that, then we're going to penalize you. And not just on the patients you've sent, we're going to penalize you on every Medicare patient you've seen for the entire year. We're going to aggregate it all, take 5%. Now, if somebody comes to you and says, I'm going to take 5% of your income, it's probably going to affect how you go about making your decisions. Now, these are trained professionals, these are primary care doctors, and now you're putting them between a rock and a hard place. It only stands to reason that they're going to send their patients on to specialists less often. It doesn't matter if your daughter broke her arm and needs an orthopedic surgeon. All that matters is they're above the 90th percentile. It doesn't matter that your mother's short of breath and needs a pulmonologist. All that matters is they're above the 90th percentile. And they're going to work hard to stay out of that, and they're going to try to stay out of it by not sending those patients on to the specialists that they, in their own professional opinion, have determined that patient needs. The other way they're going to try to stay out of that 10% is they're going to quit accepting patients who are the sickest patients. They're the ones who are going to need to be sent on most often. So we're going to create a system where the sickest of the patients are going to have the hardest time not only finding specialists, but finding primary care doctors. And finally, probably the easiest way to avoid the 10% is avoid Medicare altogether. And already 42% of doctors won't accept Medicare. And so we can feel great about putting that shiny Medicare health card in your mom's hand, but what good will it do if she can't find a doctor who will accept it? The plan that I see in the Senate, that Nancy Pelosi is trying to ram through the House in all kinds of ways, that plan, as I see, makes our existing problems even more so. We add more government to the mix. We bring in more government making decisions of what insurance companies can and can't do, and with every decision they make on behalf of the insurance company, your premium goes up. And every time we do that, we price more people out of insurance, and we push more people into the non-insured group, which in my mind is, I don't know how to justify that as even being close to anything we can do. We do have a problem with people who are uninsured and people who are underinsured. And America is not only the most successful medical healthcare delivery system in the world, we're also the most generous country in the world, and we need to take care of those, and I think all good Americans would agree with that. We need to find out how many people those really are that really need our help, and we need to put our efforts to them. When you see that 9 million people who are uninsured have an income of over $75,000 a year, and they're driving cars, talking on cell phones, and watching HDTVs, I don't know that I can consider that in good conscience to be part of the problem. I don't know that I can turn to the school teacher or the police officer or the nurse or the secretary and say, I'm going to have to raise your insurance premiums, or we're going to have to charge you more taxes because that guy over there doesn't want to buy insurance. So I have a hard time accepting the premise that we have the 30, and the number's always dancing around, the 30 million, the 42 million, they always have some number and it changes, that's true. We also have several million people who are currently eligible for help who don't even bother to sign up. When we boil this down to the people who really need help, the working poor, we're probably closer to a number around 10 to 12 million people. Now that's a manageable number, and we could buy private insurance from them. The government doesn't have to create a new agency. We don't have to create a new level of bureaucracy. We could, if we were to so choose, just buy private insurance for these people out of the savings we could have alone if we would just eliminate junk lawsuits, for example. It's all there. The components are there. We can make this better. But to ram through this bill, all it will do is take our current problems and grow them. The problems with the American healthcare system all too often are that government has grown too big and taken too much control. And you will never solve those problems by growing government even bigger.